Hey, I'm Kieran Oudshoorn, and on this third anniversary since the start of the COVID pandemic, I want to tell you a story. Imagine there was a tool, something that could be used to detect pandemics before they even happen. That could help us even prepare to contain a virus like COVID before it's allowed to spread. Now, what if I told you that tool actually exists and that Canadians built it, and that in the middle of 2019, right before the pandemic hit, it was effectively silenced? It's called the Global Public Health Intelligence Network, or GPHIN.
The mission of GPHIN is to provide early warning and situational awareness about public health threats.
Now, GPHIN was the very first computer-based system to monitor 24 hours a day the worldwide news media, and it worked.
It was started in 1997 by this guy.
I'm Ronald St. John, a physician. I retired as the first Director General of the Center for Emergency Preparedness and Response and had responsibility for GPHIN, among other things.
He and his colleague asked a simple question.
Can't we find out some way to get information about what's going on in the world with infectious diseases, and so that we can be better prepared just in case something happens to come to Canada?
And the idea they came up with?
Gather lots and lots of information from around the world about outbreaks of infectious disease. Look out for the unusual one, the one where we don't know what's happening, but people are sick and dying.
GPHIN does this in two steps. First, a computer gathers newspaper reports from all over the world, looking for reports of outbreaks.
So that if there's an outbreak of cholera, GPHIN will find it. If there's an outbreak of measles, GPHIN will find it. And if there's a report in the media that says some children are dying in a remote village, but unknown cause, we don't know what it is, GPHIN will find it.
Those reports are collected and sent to the Canadian health officials. The second step involves a multilingual team of analysts who sort through the reports. They find the ones that seem to indicate significant health events, and then they send an alert to the global health community saying, this is something that you should probably keep an eye on.
GPHIN collects a lot of information. A good part of that information is relatively routine. We know from experience will not be a global pandemic or will not be a major threat to Canada or a large number of countries. The analysts, in turn, they identify if something in that raw data is unusual.
Sounds useful, right? Health officials around the world seem to think so. Agencies like the World Health Organization and the Centers for Disease Control in the U.S. were among hundreds of clients that relied on GPHIN for early information on emerging diseases. And it was effective. GPHIN played a role in the early detection of H1N1 in 2009, containing Ebola outbreaks in West Africa in the mid-2010s. And
SARS is the pandemic that did not occur. And it didn't occur because GPHIN found the pandemic to be of SARS 3 months before WHO actually announced it. And because of that, we were able to stop the SARS pandemic.
For more than 2 decades, GPHIN was used by health officials and organizations to give governments as much time as possible to act to contain the spread of deadly diseases.
The more information you have, the sooner you have it, the better prepared you will be to initiate your response. The more lives you will actually save.
But after the mid-2010s, things started to change. There was this stretch of not a lot of major outbreaks happening, and GPHIN's value seemed less evident.
There was a question, well, why are we doing all of this monitoring for global events if they're not happening? But you have to monitor, and just in case they do happen.
Government administrators didn't agree. An investigation by the Globe and Mail revealed that in May of 2019, the government decided to, quote, shift priorities inside public health. That's the Public Health Agency of Canada, where the GPHIN team was housed. The Globe reporting went on to reveal, quote, with no pandemic scares in recent memory, the government felt that GPHIN was too internationally focused and therefore not a good use of funding. The doctors and epidemiologists were told to focus on domestic matters that were deemed a higher priority. Ultimately, the program's analysts were reassigned to other tasks, and GPHIN's system became less and less reliable.
As a result of that change in policy in May of 2019, GPHIN was told to stop issuing any global alerts.
The Auditor General of Canada found that in 2018, the agency made it harder and harder to issue alerts, resulting in just one alert being sent out the following year, compared to the several alerts per month that they've been issuing previously. And May 24th, 2019, GFIN sent out one last alert before falling silent.
Unfortunately, that was 7 months before COVID-19 came along in December of that year, 2019.
The first media reports about a viral pneumonia outbreak in a Chinese city called Wuhan came in December 31st, 2019. 27 cases, with hospital officials saying the cause of the disease wasn't clear.
And there was no global alert issued when the first reports in the media on December 31st, 2019 came out of China, and GFIN actually picked it up, but no global alert was issued because GFIN was stopped from issuing global alerts at that time.
When word got out that this early warning system that was meant to give us a heads up about unknown disease outbreaks like COVID hadn't done its job, people wanted answers.
Can you explain to me why an emergency alert was not issued by GFIN about COVID-19?
The problem seems to be from the report that nobody was listening. There was a monitor on the patient, but nobody was looking at the monitor.
Because of what I call an epic failure of systems and imagination, we missed many significant signals as COVID began its relentless march across China and then globally.
So where does GFIN stand now? Well, it still exists, and it's back to issuing alerts, but an independent panel of experts reviewed GFIN, and they recommended that the program be given a clear mandate, better technology, and to collaborate with more partners doing similar work. And after a pandemic like COVID-19, the importance of a system like GFIN is crystal clear.
There is no regular cycle for pandemics, so there's no knowing when it will occur again. So either you say, well, maybe it's going to be 100 years and you decide I'm not going to do anything. Or maybe the lesson is that you need to be on a certain level of alert all the time. We just don't know when nature's going to send something our way that will be difficult to deal with. And that's what GFIN is. It's on alert all the time, looking for that unusual event that might create a problem for us sometime in the future.